Coronavirus, otherwise known as COVID-19, ravaging the entire world, has obviously occupied the position of most devastating challenge of mankind in the 21st century. No doubt, COVID-19 has successfully, unfortunately though, triggered chain of reactions and response among world leaders. The deadly scourge has caused leaders to shut down economies, order closure of vital institutions, and alter the human social order.
Let me begin by again expressing our support, solidarity, and love for the people of our great country. We're fighting for you, and we're enduring all of this together, and we will soon prevail together.
In Nigeria's oil-rich Delta State, Governor Ifeanyi Okowa has taken charge of dealing with the situation like a leader should. He has on several occasions addressed the good people of Delta State to underscore the need to keep safe in the face of an unseen enemy, a ravaging global pandemic, the COVID-19.
Fellow Deltans, while this government will spare no effort or resources to ensure the health, safety and protection of citizens, it is important for us to know that observing proper hygiene and World Health Organization mandated safety protocols remain the best way to protect ourselves and to stop the spread of this virus.
Tough times don't last, but tough people do. This time-tested adage aptly captures the actions of great leaders who have all stood up to be counted as women and men of valor in defense of their people. Governor Okowa is leading from the front as the State Central Committee on COVID-19, which he chairs, has continued to churn out strategies and actions to defend Deltans and all those who live and do business in the state. The exploits recorded in the health sector in Delta State under the watch of Senator Ifeanyi Okowa has helped the state to contain the spread of previous infectious diseases such as Lassa fever, chickenpox, monkeypox, and many others in recent past. With these experiences, the governor and his team have strengthened the state's preparedness to fight coronavirus COVID-19 and stem possible spread in the state. With the deadly virus already here in Nigeria and threatening the health and socio-economic well-being of the nation, Governor Ifeanyi Okowa took far-reaching proactive steps.
All land borders into and out of Delta are to be shut effective 6 a.m. Sunday, March 29, 2020. All business malls, supermarkets, markets and shops are to close from Wednesday, April 1, 2020.
Not done yet and not prepared to take any chances, the governor rolled out further measures to stop COVID-19 in its tracks in Delta.
Food sellers are to conduct their businesses within the precinct of their homes and are required to strictly adhere to the social distancing rules.
Prior to all these measures, the Okowa-led administration established 4 isolation centers at existing hospitals and equipping them with ventilators, ICU beds, and other medicaments preparatory for anything COVID-19 might throw at the state. Asaba Specialist Hospital is one such facility where the governor has gone for inspection severally.
We must clearly spell it out to those who are collecting.
They are fully ready and the trained staff are fully ready, and I can truly say that this center is ready to receive any case.
We are ready for any case. For the equipment, if you look in our center, we have all the equipment you need from handling any case, from the mild case where they do not need any oxygen therapy, to even when they just need a little bit of oxygen therapy through the nasal cannula, to very severe cases where they will be needing the ventilators.
Prior to the inspection visit to the Central Hospital in Asaba, Governor Kowa, in company of his friend and colleague, Governor Aminu Tambuwal of Sokoto State, visited the Federal Medical Center, where the state has built and equipped an isolation and treatment center.
Governor Kowa must commend him and his team for a very wonderful transformation of Delta State. Delta is getting ready for coronavirus and some other related diseases. I hope that we shall not have any reason or cause to use this isolation center.
Smart Delta media team made follow-up visits, first to the facility at the Asaba Central Hospital to see how things have further progressed. We met with the facility manager, Laura Ade, and other staffers who shed more light on unfolding scenarios.
Delta has always been a very proactive state. If you look at how much our governor has put in already in a very short time, you would know that we are way ahead.
This is a CCTV camera. This is a way to checkmate whatsoever goes on here. It's a 24 surveillance which we use to monitor our staffs, our patients, and everybody that walks in and out of this place.
Our desire to find out more facts about several smart initiatives of Governor Ifeanyi Okowa to combat COVID-19 took us to the isolation center located within the precincts of the Federal Medical Center FMC in the capital city. During the visit, we met the Chief Medical Director, Dr. Victor Osiatuma, who took us on a tour of ongoing facilities whilst work was still in progress.
So you come in here. Okay. This was completed about 7 months ago, way ahead of COVID. The amendment you're seeing now is because we had to modify to suit COVID.
With all these in place, knowledgeable manpower could become a challenge to man sophisticated ventilators as well as manage patients if need be. But the governor allayed all fears by directing the health authorities to assemble and train medical personnel and a host of other first responders.
We have taken certain steps to mitigate the impact if and when cases are detected in our state. Health staff have been trained to protect healthcare personnel and increase capacity. Personal protective equipment for health staff are in stock, and we have continued to scout for more. The state government has also packaged incentives for critical health staff who will be engaged in COVID-19 treatment and management.
The desire to bring the isolation and treatment centers closer to the people further propelled the Delta State government to set up the Ogara and Warri centers. The isolation and treatment centers are without prejudice to 12 holding centers set up at zonal levels.
Smart Delta.
Our quest to follow up through the state of affairs at the facilities took us first to Ogara General Hospital. Here we met Dr. Onome Ogwe, Chief Medical Director and Coordinator Del South Isolation Center, and Head Nurse Tega Notoma. The Mental Care Center was converted to COVID-19 Isolation Center. We toured the facility, which includes holding room, clinic, doctors and nurses safe areas, doctors' quarters, and pharmacy.
Governor being a doctor, he's just been wonderful because he has been proactive in the steps that he has been taking, and we are following that lead. It is why, for instance, we already have an accommodation for doctors and nurses who will be looking after the patients.
Actually appreciating His Excellency for the work he has done to ensure that we have the things to work with, because that is the number one thing, our PPEs. And I can tell you that we've had about 600 pieces of PPEs supplied to us.
Dr. Ogwe further informed us about availability of trained personnel and paramedics, a position supported by head nurse Tega. He also hailed the government for being proactive by getting ahead of the virus, noting that it was cheaper to prevent than cure.
The only way to really deal with this condition is prevention. Prevention is by far cheaper, and cheaper in terms of funding resources, and cheaper in terms of lives that you will save.
We are fully prepared. And as I speak, even though they trained about 11 nurses, about 10 more has actually volunteered themselves for this service, which we have included.
We also met a clinical engineer, Nsekak Abraham. He was busy installing accessories for ventilator in the clinic and a dedicated ambulance.
This ambulance is solely isolated for the COVID-19. I brought in a transport ventilator and I tried to check the oxygen bottles. The oxygen are there, both for ventilation and normal ventilation. There's water for humidification. I checked the suction machine that is working. Check the BP to check for the BP, because solely, COVID-19 is mainly on respiratory. So that was why I had to really check the ventilator that is up to and is working perfectly very well.
We also needed to know the innovation he brought into installing oxygen tanks. This is what he said.
Because it's an isolation ward, we didn't want a situation of keeping bottle by the side, bottle of oxygen. We need a constant oxygen. For this place, it's going to have a central oxygen, whereby it's going to be piped down. So there'll be a pipe coming down from here, pipe for medical air, pipe for oxygen. So it's just for you to plug into the wall and get access to your oxygen at 24 hours.
Any virus.
The ambulance driver, Dennis Okeribo, did not escape our attention. We asked him how prepared he was for this challenging humanitarian task to save lives.
I was given a training that if any virus affecting somebody, we should queue up, wash our hands and hand gloves before carrying any suspected patient.
As it was in Ogara, so it is in Warri. We met Dr. Isaac Akboveta, who chaperoned us around the isolation facility in company of the Zonal Medical Director, Warri Central Hospital, Dr. Paul Okubo. On the tour, we saw the place was ready to admit patients if need be, as ventilators, ICU beds, CCTV cameras and others have been installed.
His Excellency has graciously simulated the system, and the 33 kVA step down was activated. So now we have 90% BEDC light in this place. In terms of energy, we have no problem. Here we have 4 ventilators already, and they still have reserve in Asaba, in FMC at Ogara, and in the store.
In terms of performance with respect to COVID-19 prevention in Delta State, His Excellency, the Governor of the State, has done excellently well. And you can see it with the number of treatment centers that we have in Delta State. You don't have that number in any other state. Trainings have been going on even before now with respect to management of patients who end up with COVID-19.
Delta State government takes the issue of compliance very seriously. For instance, this is the border post between Delta and Edo States, Saturday, 4th of April 2020. Drivers of this long queue of fuel tankers on essential duties were screened before allowed into Delta State.
Don't do your test and go back to where you're coming from, since you cannot obey the rules.
With new developments unfolding daily, nationally and globally, the Delta State government makes adjustments accordingly. With coronavirus infestations in Nigeria spiking from single to triple digits, Senator Ifeanyi Okowa had to shut down Delta's borders to vehicular and human traffic in a bid to prevent infected persons escaping into the state. The Secretary to the State Government, SSG Chieduebie, in company of top government officials and a team of reporters, were out till the wee hours of the morning monitoring level of compliance. This was what we found.
People should learn how to respect order. They are pretending as though they don't know.
Go back to where you're coming from. Where you're going to.
We all know what this virus is all about and how it's a novel virus that has no vaccine, no cure. So we're taking preventive steps because we need to ensure that the people of Delta State are protected.
With continuous spiking of figures and more states hitherto without cases having positive tests, Delta State government had to adopt a painful but necessary action of a total lockdown.
With effect from Wednesday, April 1, 2020, movement of persons goods and services into, within, and out of all parts of Delta State are hereby stopped. All residents of the state not an essential duty of providing essential services are to stay home till further notice. The state government solicits the support, patience, and cooperation of all residents in complying with these directives to enable us win this war.
This is what the city looks like as inhabitants comply.
Having gone around the city, I have discovered that the inner access of Asaba metropolis is like a haunted town with empty streets, locked up shops. Wow, this is the new normal COVID-19 has imposed on mankind, condemning us to wearing face masks, forcing our hands into hand gloves, avoid social gatherings, and our loved ones. As painful as this new normal is, we must comply if we have to defeat and stem the spread of this unseen enemy, COVID-19.
With the shutdown of national and local borders in Nigeria, a South African tourist trapped in the country says, despite her disappointment of not being able to go home as she planned, she is comfortable in Delta State during this trying time.
I feel safe and I feel like I'm being taken care, well off. The borders are closed, meaning the whole of Delta State right now, if we all cooperate with the government, we are safe. Coronavirus is real. It is happening out there. People's lives are going down because of this. If we all just work together, there can be a solution to all of this and things can go back to normal.
Prior to total shutdown, Smart Delta Media went to town to find out responses and preparedness of different strata of society to COVID-19. Places we went to include schools and markets, parks, airports, and public places. At West End and St. Patrick's schools, we had a chat each with the heads of schools and students.
Washing our hands, maybe when you are last from a car, or you count money, before rubbing your face, touching your nose or eyes, we wash our hands. We've equally told our students the same thing.
We want to say thank you to our governor for helping us in country, like providing sanitizers for school and gloves and nose guards for people in school.
If a child.
The Commissioner for Basic and Secondary Education, Patrick Uka, added his voice to the shutdown directive and explains plans put in place to keep the pupils and students engaged during the lockdown.
We have made arrangements to see that the children can continue their studies. We'll be starting about 2 hours lessons on radio and television, revision of past question papers for children preparing for primary 6 exam and those preparing for WAEC.
At Obogonogo Market, we met a group of market women and their leader, Mrs. Lillian, teaching her fellow women on how to wash their hands and apply hand sanitizers.
The virus is very, very deadly. And we have seen that if it comes into a country or a community, it goes round within a twinkle of an eye. As the leader of Obogonogo Market Union, myself and our executive, we said no, that we will not allow this to happen in our market. So we initiated this system of washing your hands before you go into the market.
Since this COVID-19 crisis, government has put premium on sensitization campaign. This is predicated on the fact that it is easier to prevent than to cure. This thinking has led to media bliss on radio, television, print, and even on the streets.
You stay in your homes at a time like this much more than any other place. You will have to wash your hand. We want it to become a culture, because the more you wash your hand, the better it is for you.
Delta State government is doing a lot in terms of preventive and curative. So to that extent, we are doing the needful in terms of giving the right orientation to the people on how to carry themselves within this period, especially in the face of the lockdown.
The government has said everyone should stay back at home. It is necessary for us as a people to comply. It is for our own good.
With the sad news of tumbling numbers of COVID-19 infection, the State's Commissioner for Information, Charles Aniago, addressed media practitioners and emphasized the need for people to exercise restraints in spreading fake news.
The orthodox media need to help us so that we do not begin to chase these other individuals who that you may call citizen journalists. Let's not just raise unnecessary alarm.
Smart Delta media team visited the Asaba International Airport to know how seriously people took the issue of precaution.
Being so fearful is not the remedy, but applying the necessary caution, yes, social distancing, wash your hand as often as you can, stay at home. These are the basic things that needs to be observed.
We always have an ambulance here stationed 24 hours of the day in case of any emergency or casualty.
At the popular Asaba Mall and other malls in town, we witnessed some degree of compliance as shop owners insisted on safety protocols to stem the spread.
We had to put automatic hand sanitizer, and every customer coming into the office must use it. And of course, for us working in here, we have to, of course, because we deal with customer and customer care, we have to protect ourselves using the masks and the gloves, and of course, sanitize ourselves as well.
In our office, every customer that comes in, we ensure they wash their hands first with a liquid soap. Some, maybe they are in a hurry, they couldn't wash. We have the hand sanitizer there. They sanitize their hands before we attend to them.
Our team made another trip to Warri. This time, our mission was to check on the general public. We ended up at the Warri ShopRite Mall and Osubi Airport, where we observed that nothing was happening in compliance with government directives of no flights. However, security presence was heavy.
At our entrances, our guards are there sanitizing people's hands. Then the shops, each shop has a sanitizer, has a measure for people to take care of themselves. Washing of your hands, you sanitize yourself, you go in, and we educate them if your shop is too small, you don't cluster people. If people are much, you educate them to go out and try to keep social distance. I want to believe that 90% of Nigerians know that it's real, and it has no cure for now. So the measures we have to take, you have to respect it.
Done with Warri and back to the state capital, we headed for the Ministry of Water Resources. Our mission was simple: to find out how they intend to provide enough water to the populace in this era of continuous hand washing.
We are assuring that wherever there is a need, we have a tanker that will take water to the local areas where the taps are not functional.
We also went back to the isolation center at the Federal Medical Center, FMC, to see the final touch and progress in the center. There are a number of highly trained professionals on the COVID-19 team in the state. As it is not possible to talk to all of them, Smart Delta talked to key personnel like Dr. Ofili, Director, Transport and Ambulance Services, Dr. Osuyali, Director, Antiviral Medications, to know how ready they are.
We are going to be the communicating system between these treatment centers and their holding units. If people need to move from the holding centers to the treatment centers, that's where we come in. We have this high roof ambulance. It's built as a mini ward. The people in there can stand up, give IV lines. We have oxygen, we have monitors, we have suction machines.
Delta State is 100% ready because the state government has done and supported this cause well enough. World health standards and protocols have been observed, and we have equipped ourselves ready.
With the lockdown biting harder and Deltans experiencing shortages in food supply, government set up a food bank from where essential food items will be shared to the poorest on local government area basis.
We have actually started a food bank. In the next few days, we will be moving the food banks to support our people in the various villages, towns, and wards of the state.
As the lockdown, social distancing, and other government protocols to fight COVID-19 continues, the government and the good people of Delta State hope the state will remain safe and come out of this pandemic unscathed and stronger.
Delta State government is committed to building a stronger Delta. Whatever agitates your mind, ask it, and we will get you answers.
Now we would actually urge all Deltans and non-Deltans to continue to be in tune with the Smart Delta team, because they're everywhere. It's important to get informed about what is going on in this state. If you're going to pass suggestions to us as government, your suggestions will be welcome. To know more about them, follow Smart Delta on their various links.
Send your questions to all our social media platforms with the hashtag #AskIt on Facebook, Instagram, and Twitter, or text 0901-665-2274, airing on AIT, Channels TV, Silverbird, NTA Asaba, DBS, and DRTV.
You better run, come to Delta State. Come and see the good things where Okowa they do. You better run, come to Delta State. Come and see the good things where Okowa they do. I see your job and work creation in Delta, make the youth say them highlight Okowa. I see good roads everywhere in Delta, make the people say them cola. Come live in Delta. Say me I say, come invest in Delta. Come explore the potentials of our state.